together.
They Zach and Calhoun both did every week, every Tuesday.
Okay.
There would be probably 4 times a year, maybe, that they would just cancel because they really didn't have enough stuff, but otherwise they met every week.
We run into about 2 sure that it gets per East Wednesday.
Well, I think it's good that you got it scheduled, then you can cancel if you always have to.
It is.
Thanks, Ben. You're live.
Okay. Dean, I'll probably give you a
Hey, folks,
call
how's
after
everything
the meeting.
going?
Okay.
Can everybody hear me okay?
Yeah, I hear you fine.
Wonderful, wonderful, folks. For the people that are here, just to kind of introduce myself real quick, my name is Lance. I'm here with Compliancy Group. I know Dalton had set this up for us. I believe we're waiting for a few more people to jump in. Is that right?
Yeah, I think so. I think basically we'll probably take care of Zach here first, and then we have a public hearing at 9:30, so we'll probably take care of you after that. So it'll be a little while before we get to you.
No worries at all.
Okay.
I've got 5 trees coming down this morning, so there may be a chance that I may have to slip away once in a while. So.
Okay.
By choice or by disease?
Actually, the REC is taking them down.
Oh.
So there's interference. You know, they want them down before they go down on the lines. So. And they're ash trees, so I'm not too sorry to see them go.
Yeah, it's gonna be one of the, it's inevitable anyway.
Yep.
Okay, it's 9 o'clock. Let's start with the Pledge of Allegiance. I pledge allegiance
Pledge allegiance to the flag
of the
of the
United
United
States
States
of America, to the
republic for which it stands, one nation,
under
under
God,
God,
indivisible,
indivisible,
with liberty and justice for all. Okay, good morning, everyone again.
Good morning.
We have the agenda before you. Is there any additions or corrections to the agenda?
If not, I'll make a motion to approve the agenda.
I'll second that motion.
Okay, it's been moved and seconded to approve the agenda. Any further discussion? If not, all those in favor signify by saying aye. Aye.
Aye.
Motion carried. Next is approval of the minutes.
Minutes, I thought they read well, even with the short meeting. I'll go ahead and make a motion to approve the minutes from February 22nd.
I'll second.
Okay, it's been moved and seconded. Any further discussion? If not, all those in favor signify by saying aye.
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 Contrary, motion carried. Okay, Zach, you got gravel contracts.
I do. Got a few things today. First is a gravel contract with Stratford Gravel. This is for production at the Kate's Pit up in Sac County. We have gotten gravel from them before. I believe it's been 2 or 3 years ago. It was very good gravel. Are looking at doing the rock blend with it like we did last time. Looking for 100,000 ton this time up there at that pit. I guess any questions regarding, I think you guys have all seen that gravel to some extent maybe, but maybe not Scott, but it is really good stuff and pretty good access as well.
Okay, any other questions? Otherwise, I'll make a motion that we authorize him to purchase 100,000 tons for Stratford gravel at $7.62 a ton.
I'll second that.
Okay, it's been moved and seconded. Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Contrary, motion carried. Kate?
Second contract I got for gravel is from Hallett Materials. This would be out of their Wall Lake pit. Again, another place we've gotten gravel many years in the past, every year as far as that goes. Looking at between 20 and 30,000 ton up there this year. The price is $7.50 a ton, and this is just their gravel pit run out of their pit. So kind of nothing different from the norm that we've had done in Hallett Materials.
No blend, just a pit run.
No blend. Yep.
And somewhere between 20 and 30,000.
Right. And this would be, again, this is stuff they were produced this summer basically. So this we wouldn't be getting till next fiscal year.
And that's budgeted for, and
Correct.
very good. Okay, I'll make the motion that we approve that portion of the purchase to 20 to 30,000 ton at $7.50 from Hallett Construction.
I'll second.
Okay, it's been moved and seconded to approve the purchase of that gravel from Hallett's. Any further discussion? If not, all those in favor signify by saying aye. Aye.
Aye.
Contrary? Motion carried.
Thank you. Next thing on the list, we did have our bid letting for our HMA pavement widening resurfacing on N33, the road from the country club down through Willie to Dedham. That was back on February 16th. We did get 5 bidders on that project. Lowest responsive bidder was Norris Asphalt Paving for $2,838,135.69. That was a little bit under our estimate. Norris has done work here in the past, done a really good job. Really can't say a bad word about them. I think they'll fill that void pretty well. So it's definitely a road that needs resurfaced. Winters hasn't been kind to it either. So it's
Repeat that full amount, it's
$2,838,135.69.
Thank you. I don't have it.
Now, they were actually second low bid, but there was a bidding issue with the low bidder.
The low bidder had basically filled up on the contracts, the amount of work that they can get for the year. There's a provision in the DOT that allows them to bid it that way. And because they were basically full, their bid basically gets like thrown out, if you want to call it that, in this case. So we go to the bidder per se, which would be technically the second low bid.
So how many miles is this total?
I believe it's between 10 and 11. I'll tell you in a second. I got plans along. $10.1 miles, Gene.
10.1. And is this got the extra width to it?
It does.
Okay.
For the 4 foot base widening, and then the surface on the whole thing.
Okay. And this is how many lifts?
3 inches. So they'll put 2 lifts. Well, they'll do the base widening first, and then they'll put an intermediate lift across everything, and then a surface lift across everything.
So 2 lifts. Okay. when is they plan on doing this work, or start date or?
I don't know. Our late start date is, I believe, after the 4th of July. If I had to guess, I'm guessing it'd be probably earlier in the summer than that. I don't think they'll wait that long to start, but they have to start by the beginning of July.
Depends on where they're the contractor at.
Okay,
There's a lot of asphalt that got let this year. There's a lot of busy contractors.
well, I just kind of wondered, so I knew. Any other questions for Zach?
Yeah, so are they going to remove the material out of the existing shoulder right now, like about a foot or something like that, I think it was?
I think
And then
8 inches. 8 inches.
8 inches?
What we end up taking out, I believe. And they'll do that and put the asphalt base in at the same time. That'd be that
Right.
frame they normally use. So that'd be the first step in the process.
Are we pulling that or just rolling?
They're going to pull most of that off on the edge, and then we'll blade it back in and tie that back into the paved shoulder after we're done.
Zach, can we get, can you email us all the bids?
It was
Yep.
with their stuff he sent Friday, I think.
The apparent bids I did. If you want the bid unit prices, I can send those out as well.
Okay. Is it with your info, all the information here?
It should have been the one I sent on Thursday.
Oh, okay. Got it. Thank you.
Any other questions for Zach? Okay, is there a motion to approve an award to bids on the
Award of contract.
for the contract?
Okay, go ahead, Dean.
I'll make that motion.
Okay, I'll second that.
Okay, it's been moved and seconded. Any further discussion? If not, all those in favor signify by saying aye. Aye.
Aye.
Contrary, motion carried. And this comes from farm to market and out of our pool, right?
Yep, we're using some farm to market money, Gene. We're using some of our STBG surface transportation money that we get as well. There's $750,000 of that money we're using, and then the remainder is the farm to market.
Okay. All right. So that takes care of that. Now we need to approve resolution 2021-004, allowing the engineer to sign the contract.
Allow Zach to sign the resolution or make the motion to approve resolution 2021-004, allowing Zach to sign contracts.
Is there a second to that?
I'll second.
Okay, it's been moved and second. Any further discussion? If not, roll call.
Myers,
Yes.
Shetler,
Yes.
Reynolds,
Yes.
Austin,
Yes.
Johnson.
Yes.
Okay, motion carries. Do you want me to have them sign this one or?
Yep, that's fine. Yep.
Okay, continue on, Zach. Utility permits.
Yep, 2 utility permits, both from Mid-American Energy. First one is for some fiber that they're looking to put in to connect their system. Basically coming from the southwest part of Carroll, which this is kind of a continuation of other projects that you have seen. This is basically going from the west side of Carroll, going west to the county line, Crawford County line, getting to basically to west side is where they're getting. All of it along 200th Street. They'll be plowing it in along the edge of the gravel road and then boring all the culverts and structures.
Any questions on that utility permit? If not, is there a motion to approve the utility permit for Mid-America on Kitty Hawk and 200th Street to add an Aspen?
I'll make that motion.
I'll second.
It's been moved and second. Any further discussion? If not, all those in favor signify by saying aye. Aye.
Aye.
Contrary, motion carried. Okay,
Next one is for basically getting three-phase power up towards Litterdale. That'd be on Quail Avenue from Highway 30 going north 3 miles. They'll be putting on the west side of the road, putting in new poles. So some of that area is being served by REC. I believe they're working it out that REC will hang off that same set of poles in the areas where REC is, but they'll be going all 3 miles up north to Litterdale on the west side of the road.
okay, is there a motion to approve this utility permit?
I'll make a motion to approve that permit.
I'll second.
Okay, it's been moved and second. Any further discussion? If not, all those in favor signify by saying aye.
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 Contrary, motion carried. Okay, Zach,
Last thing on my list, wanted to just quickly to talk about limestone a little bit. I know last winter, basically right when I started, I believe we did a limestone quote out to the local entities to get limestone brought to our shop. I'd like to do the same thing again in the amount of 10,000 ton. We do have some limestone left in our pile, but it is dwindling, and I'm just trying to prepare for what could be. Hopefully it's a good year, but if it's not, make sure we're ready if we need it.
so you're going out to the same bidders that we had the last time then?
We'll send out to all the same bidders that we did last time and see what we get, and I'll bring quotes back to you in 2 weeks.
Anybody have problem with that?
No, I have a question on the top. It says 10,000 total tons, and your minimum delivery schedule, you have 4, 7, and 10.
Basically trying to get some in 4,000 ton by May 15th, so they at least have some in there in case we wouldn't need a large sum yet this spring. We do have quite, like I said, some on hand still, but basically at least get them started so we're not waiting until the end of the, I guess, in the middle of the summer before we get all 10,000 ton.
Well, that probably meant that by spreading it out like that, you'll be able to get more people to bid on it and be more easier to deliver on time.
Hopefully, and it's actually better if it comes in a little slower for us anyway, for pushing it up, and then we can kind of look at it that way. If you get a whole slew of trucks hauling in, then it gets a little bit chaotic as well, so.
My other question is the quality of limestone the same out of either one of these quarries?
Very similar. They're both, they have a little bit different color to them. The stuff from Martin Marietta seemed it's a little whiter compared to what's out of the Griffith quarry. But it is very, very similar type of rock.
Okay. Anybody have any other questions?
No.
Okay, we need a motion then to authorize him to go out and solicit quotes on this.
Also move.
I'll second.
Okay, it's been moved and seconded. Any further discussion? If not, all those in favor signify by saying aye.
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 Contrary, motion carried. Anything else, Zach?
That's all I had.
Thanks, Zach.
Okay. Is Dalton there?
No.
Ben is. Do you have
Uh,
an IT question for Ben?
well, do we want to go and wait? We want to wait till after the hearing to do that other,
Yeah, we only have.
No.
because Dalton will probably want to be involved in it, right?
Maybe approve the plots.
Yeah, I say number 5 or number 6, but
Let's go with number 5 to start with. You want to talk about that, Courtney?
Or, I'm gonna pull my mask down. Can you both hear me?
Yeah,
Yep.
I sent you guys a copy of the email, that we received the $157,013.40. So that was automatically deposited into the county's account, and we had to do some research on, to find out what that was for. After talking with Sarah Schulte and Joel Anderson with the state of Iowa, the money was to reallocate funds from the 25% FEMA match they had set aside, plus any city funding that was never requested in Carroll County. It is a reimbursement of costs the county has incurred, and it would be for the Board of Supervisors to determine what to do with these funds. So I wanted to let you know we got the money. We went ahead and deposited into the local option fund, which is where a majority of our COVID expenses have come out of. It's sitting in there, and I thought that you guys should probably discuss if you just want to keep it in there and use it to pay for some of our COVID expenses. We have used quite a bit of it paying for contact tracing, and we have not submitted a claim to FEMA for those expenses yet. So, like I said, it's up to the board to decide what to do with the money.
well, I think we should leave it in there, and being that came from COVID, use it to take care of any COVID expense that comes down the road here. I'm sure there's gonna be some that we're not gonna get reimbursed for.
Courtney, what are our actual COVID expenses? Do you have that number?
I don't.
I mean, I'm sure it doesn't come up to the $157,000.
No. I mean, we could use this, I talked to Sarah Anderson briefly, I think it was Friday. Some counties are using it to implement, and I might be using the wrong, like an EOC. I don't know. Jason talked briefly about that at our meeting we had with some department heads. Like a command center, you know, for like in the future, if this would happen again, a place where you could have computers set up and things like that. Some other counties are doing that. They're kind of getting a place aside to have like kind of a command center for disasters or whatever. So that was something that she mentioned. Obviously this money's there, and like you said, we probably haven't spent that much. So whatever's left, I suppose you could use that to do future planning, you know, in the case of a disaster or another whatever.
Yeah, Jason discussed that at our 911 EMA meeting, the last one we had. And yeah, I think that's a ways down the road. I don't think that's anything that's going to happen, you know, in the next 12 months or probably 2 years. But I think a lot of that depends on what happens after we get everybody moved around. That center could possibly be down in the basement, you know, and I don't really know how much space is going to be required for that. Actually, I mean, if you had an emergency, you could set up tables in the hallway down there. You know, that'd be large enough. The biggest thing is you would have to have access to hookups for computers. So that would be the biggest thing. But
Well, we don't really.
It's a good use of money, I guess. That money, some of that money, anyway.
I was going to say we don't have to spend this right now. The thing is, we could use this if something changes with public health. We could use that money for that probably too, couldn't we, Dean?
Sure.
You know, if there's something comes up there. So I guess I wouldn't. Can we just leave it there for the time being, Courtney?
Like I said, I wanted to make you aware that we got it and let you know where we put it. and we can go from there. Like I said, we've paid a lot of money out in contact tracing, and we haven't submitted to FEMA to get reimbursed for that. So we could definitely use some of this to cover the county's expense. And then whatever's left over, you can maybe use for a project, or if you want to have some things stocked out, if you want to have masks and sanitizer and stuff like that available, for future.
What do the rest of you think?
Well, I think there's a lot of places we could probably use it. I think the election side, we could certainly consider maybe some more cameras on our Dropbox. I think we got to find out the legalities of that first of all. But there's a place we could put some, probably use maybe, I don't know where Sarah's at with portable beds. We could use maybe some of those, but then it becomes a storage issue. So let's just step back away from that, not get in a hurry. I think that in time, it'll take care of itself. And in 6 months, we'll know a lot more, and maybe we'll get denied something that we've already been paid for, and we may have to pay something back. So let's just kind of keep it as a buffer for a little while. And that's my opinion of it.
Well, and I agree with you, Rich. I guess that's kind of what I was saying. I think we leave it there, and I think it needs to kind of be tied into something that's related to the COVID situation. But at the same time, I don't think we need to get in a hurry. And I agree with you. I think we just sit back and wait. There's going to be some stuff that we're probably going to get hung with yet. So,
Yeah.
anybody else have any thoughts?
I am glad that Courtney told us that we did get money for some of it anyway, because it's been kind of bugging me. Because it's not what you call fast.
Well, and this has no tied strength. It's an excess money that's left over. You said that was how much? 157,000 what, Courtney?
$157.40.
Okay. Anybody else have any thoughts?
No, I agree with you. Guys. Account for now until everything's kind of calmed down and we come up with a better game plan and make sure we cover any of our expenses.
I agree.
Yeah. Okay. Does that give you a direction then, Courtney?
But
Okay. Let's go ahead and take care of the plats next. I think we've got one there. It's for Ben Clucky. Does anybody have any questions on that? This was sent out by Sarah. Anybody have any questions on that?
No.
If not, we'll need a motion to approve.
Pretty straightforward.
Yeah.
And I'll make a motion, we approve the plat for today for Ben Club.
Okay. Is there a second?
Austin second.
Okay. It's been moved and second. All those in favor signify by saying aye.
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 Contrary, motion carried.
Gene?
Yes.
Is the first word getting cut off in the conversation again?
You know, it wasn't first, but it is now when there's some noise, but it's better than what it was.
Okay, very good.
We've been working
There was
with
a timing issue.
Yeah, we've been working with Al on that.
All right, thanks.
All right. Let's go and take care of number 7 too before we have that public hearing. This is named the depositories. This is something that we do every year. I don't think she's got any changes in this, did she, Courtney?
No.
I don't think there's an amount changes. They all look the same to me.
Yeah. Sometimes they change things around, but is there a motion to approve that?
Also move.
Okay. I will second that. Any further discussion? If not, all those in favor signify by saying aye. Aye.
Aye.
Contrary, motion carried.
Need to do a roll call because it's a resolution.
Oh, yes, that's right. Yep, you're right.
Miners,
Yes.
Shetler,
Yes.
Aye.
Houseman,
Yes.
Johnson.
Yes.
All right, motion carries.
Thank you. Okay, next we will do the public hearing on the fiscal year 22 proposed property tax levy. So you have all that there, and that sets the levies, the dollars that we will get. I will remind you and any of the public that's involved are listening in on this. This is not a true picture as far as I'm concerned, because this does not include mental health or debt service. So people need to be aware of that. This is a new regulation that came down a year ago through the legislatures. You want to go on from there, Courtney?
Sure. So this is a public hearing to talk about the Max Levy. We all got a copy of that. It has been published. I've heard no comments from the public regarding this. From the paper and the radio, but I think it was handled pretty easily. I to send you all out some information regarding how our levy is going to affect houses and property, also expenditures and revenues compared to last year. Overall, everything's, we actually saw a decrease in the levy from the year before. And like Gene said, this maximum levy is kind of deceiving because it's only talking about the general fund and the rural fund. We've also got a mental health fund and a debt service fund that almost.
Okay, is there any? Go ahead, Courtney.
I just wanted to say that regulation that came down last year, this, cities and counties are required to do this now. I didn't hear any comments from the public regarding that, and it was published, so everybody was.
Is there any comments from those on the internet?
Nope, don't see a thing.
Okay. With that, I will close the public hearing. And I do have one question, Courtney. The charts that you sent us in regards to taxes on the house, that does include the debt service and everything going, right?
Yes.
Right? Okay. All right. So public hearing's closed. We need to approve the resolution 2021-005 for fiscal year maximum property tax dollars.
So the resolution talks about the dollars. So the total dollars on the general side is $4,878,219. 537,024. And again, I remind people that that does not include debt or mental health.
Yeah, we just noticed it down a little bit ago too. The public wants to make comments to
Okay. Is there a motion? Is there a motion? Is there a motion to approve the resolution?
Also move.
Okay, is there a second? Okay, it's been moved and seconded. Any further discussion? If not, all those in favor, or roll call?
Miners,
Yes.
Shetler?
Yes.
Ruggles?
Yes.
Austin?
Yes.
Johnson?
Yes.
Okay, motion carries.
Okay. Let's go to Dalton. You have a HIPAA presentation?
Yeah, I sure do. I got, Mr. Lance So Lovely.
Hey, everybody.
So, I came to the board a couple weeks ago, with another company. After discussing with John some, we decided to kind of look around and source out to different companies. Mr. Lance is going to give us a preview of what they have for their services. It kind of gives us an idea of what other people are offering out there right now. So Lance, if you want to go ahead and take over.
Sure. Let me just go ahead and share my screen with everybody real quick. I think the host needs to give me access to share my screen.
Yeah, he's doing so right now, Lance. Just 1 second.
Yep, no worries.
Dalton, do you have a hard copy of this presentation?
I do not.
It would be nice if Lance has got one that we could get one for all 5 of us supervisors.
Sorry.
That works right now, yeah.
Okay.
There we go.
All right. Can everybody see that blue screen?
Yes.
All right. Perfect. All right, folks. So, very quickly, for the sake of everybody's time, I'm going to kind of bring you folks through the high level version of this presentation, just to make sure we are hitting the time cap that we have here. But just as a quick introduction for everybody, real quick, again, my name is Lance Levy. I'm here with Compliancy Group. As a quick introduction for you folks, all we have focused on for the last 16 years has been HIPAA compliance. Okay, as I'm sure you know, HIPAA isn't probably the main focus for you folks as a county, but in reality, HIPAA is a very, very cumbersome law that regulates the transmission of protected health information. Right now, as far as what we've done for 16 years is simply help small to mid-sized organizations, nonprofits, counties, just like yourself, become fully HIPAA compliant with the regulation. Now, the entire premise of this service is based around what we have and what is our I guess our flagship product you can call is what we call the Guard, right? A software that we call the Guard. It's entirely web-based. We'll touch base on that in just a moment, but really, what we did with the Guard, what we did with our software is we paired it with a very specific hand-holding methodology, all right? And through the years of utilizing the Guard and utilizing our hand-holding methodology, we have grown to the point we have clients in 34 countries, all 50 states in the U.S. We are the most highly endorsed solution for HIPAA compliance for the fact that no clients in the history of our organization have ever once failed a HIPAA audit, an investigation, or have ever been fined. All right, and folks, the reason for a reputation such as that is really because legitimately all that it is Compliancy Group does here is we simply mirror what the law requires of you. All right, what we come to find time and time again through the many different types of entities we speak with, different types of organizations, whether it's a nonprofit, a single, practitioner, primary care, a 500-bed hospital, doesn't really matter. What we come to find over and over again is that a lot of different entities will choose to do bits and pieces of what the law requires, right? And in turn, that's exactly why there is such a high failure rate for a HIPAA audit today. To be exact, it's over 90% failure rate, right? The trouble is, it's not that so many incidents are happening. It's not that so many breaches are occurring. It's just that when one small accident happens and the government begins to conduct an audit, the entity simply doesn't have the full documentation proving they've covered the entire extent of the law, right? And so the real tricky piece here is if you guys take a look at the government website, hhs.gov, what you'll find is that there's nearly 1,000 pages worth of this regulation, right? And the law is built intentionally vague because what's going to be effective for Carroll County is not going to be effective for the 500-bed hospital down the road, right? And so what Compliancy Group is good at addressing here is bridging that gap between what is this very cumbersome law and what is an effective compliance program while simplifying that entire process. All right, folks. And we do that through what is our methodology, okay? Now, guys, before we dive into our methodology, does anybody have any questions regarding HIPAA that you wanted me to touch on specifically, or anything as far as what I've covered so far?
I'm gonna assume
Nope. Okay, cool. Cool, folks. So let me bring you really quickly through what is our methodology here. The first step to our methodology is just like everybody else's goal, it's to achieve compliance, okay? So the first thing that we're going to be doing here is we're going to give you access to our web-based software solution that we call the Guard, right? Now, the Guard, again, it's entirely web-based, meaning you're not downloading and you're not installing anything at all. As long as you folks have an internet connection, you have access to the platform, right? You log in right through our website. Now, you all can think of the Guard as sort of like QuickBooks or TurboTax, but it's for HIPAA, okay? So everything that you are going to need to develop what is a full and effective compliance program is all already fully loaded into the software. Okay? What we're doing in addition to the platform is we're going to be pairing you folks with your own dedicated HIPAA compliance coach. And now this coach's duty is really going to be to hold your hand, and they're going to walk you through step by step everything specifically required of Carroll County to achieve what is a full and effective HIPAA compliance program. Now, what's going to end up happening here is you're going to have about 3 to 4 go-to meeting sessions with your compliance coach. So very similar to Zoom, you log into a go-to meeting room, all right, coach will share their screen with you. And then, like I said, step by step, they walk you through this entire process. Now, in between those 3 or 4 meetings with the coach, you have about 1.5 to 2 hours of prep work that gets done. And a lot of this prep work is you answering a lot of yes or no type questions about the organization, right? About Carroll County, okay? So the typical scenario when working with our county-like organizations, very similar to yourself, is if you can commit to just 1 meeting a week with the coach, you get this whole process done in just about a month, okay? Of course, that's not to say that if you wanted to move a little bit quicker, you can get this done in 2 weeks. If you wanted to take your time and take a step back and maybe do a meeting every other week, you can get this done in 2 months. There's really no pressure or stress on our end to have you move quicker or slower. You get this whole thing done entirely on your pace, right? The beauty of this whole process, though, folks, is that once you get through those 3 or 4 meetings with the coach, your entire organization is now fully HIPAA compliant, right? But like we were just saying a couple minutes ago, it's not a matter of just telling people that you're HIPAA compliant. It's not a matter of just saying it. You have to be able to prove it. And that is why illustrating your compliance is so important, right? You have to have that documentation. Now, once again, once you get through those 3 or 4 meetings with the coach, all of the documentation, all of the reporting that you're going to need to prove that you've satisfied the full extent of the law, all of that documentation will be in the Guard for you, okay? You're able to download it, print it, email it out. It's yours to do as you wish with. It's never held hostage in the Guard, okay? This is when we issue Carroll County what is our HIPAA seal of compliance, right? And that is that little silver shield you see at the top right-hand corner of the screen right now. Now, what the seal of compliance is your third-party verification and validation of your company or organization's or practices full extent of the law, okay? What a lot of clients will do is they'll take the seal of compliance and they'll place it onto the physical site of the organization, whether it's at the front desk or the front window. But what you folks can also do, especially on, which is going to be very helpful for your website, is you're able to place it on the website. Okay. Now, if you choose to place the seal of compliance on your website, it's also actionable. So anybody who wants to ensure that you are doing the right things for HIPAA, whether it's, you know, citizens of the community, a patient or a client of one of your services, whatever the case may be, what they're able to do is click on that shield setting on your website. It'll route them to us, and we as your third-party auditor will verify and validate your compliance for you. Okay. Now, folks, just to tie it all together, in the event that, knock on wood, let's say you have a particular department that has a breach, okay, and some PHI gets lost, whether it's a malware attack, you have a whistleblower, a laptop gets lost, anything can happen, right? If that incident or breach leads you into a federal audit, Compliancy Group is going to step in as your audit response program. We will defend you in the face of that audit. All right, so we will be providing the government with all the documentation, all of the reporting necessary to satisfy what they're looking into. And like we touched on before, no clients in the history of our organization have ever once failed an audit. And on any given month, we typically have 2 to 3 clients going through a federal audit. All right. Folks, the very final piece to this methodology is simply maintaining compliance. Okay. HIPAA is an ongoing law, right? Meaning every single year, we have to readdress those regulations in order to remain compliant. And so what ends up happening now is the Guard will become your HIPAA tracking tool. All right, it keeps you up to date on any changes to the law, a change to your policies, an employee that still needs training, whatever the case might be, the Guard keeps you fully up to date on. And if at any point during the year you have a general HIPAA question, you need help with an incident, or you're just not sure about an update that the software hit you with, your coach does not just go away after your initial 3 or 4 meetings. They're with you throughout the entire year. Okay, so if at any point you need any help or guidance on anything regarding HIPAA, you can always pick up the phone or type up an email and reach out to your coach. And they are, once again, they're there for you to hold your hand and walk you through that process of what you're looking into. All right, so you have on-demand support throughout the entire year. All right, folks, and really what we've covered up to this point is our process, our methodology. If folks, any questions at all as far as what we've covered?
I think we're
I
good.
don't have any.
What was that? I apologize.
I do not have any.
Cool. All righty. So folks, what I'm going to do really quickly is just bring you through the specifics of what's involved in this process, okay, and a little bit of the specifics of what is involved with HIPAA, all right? The first step to all of this and what would be considered the foundational element to what is your compliance program is what is called a security risk analysis, okay? Every entity that falls under HIPAA is required by law to conduct this on an annual basis. Now, really what this is at face value is a set of internal audits that are being conducted to prove to the government you're auditing your organization to understand what it is you do or do not have in place as per HIPAA, okay? Just like any other audit, right? Now, by nature, these internal audits, and by the way, for you folks, it's going to be 6 internal audits, right? So it's going to be your asset and device audit, your IT risk analysis, your physical site audit, your security standards audit, your privacy standards audit, and your high-tech subtitle D audit, okay? So all 6 of these audits must be conducted internally annually. Now, by nature, these 6 audits are typically pretty cumbersome. They're full of a ton of legal verbiage, okay? They're pretty hard to get through, right? So what we've done is we've taken those internal audits and we've boiled them down to plain English, yes or no type questions, okay? Which is a predominant portion of that prep work that we talked about you'll be doing between each of those 3 or 4 meetings with your coach. Now, the purpose of these audits, like we just said, is to identify what it is you do or do not have in place for HIPAA, right? So rather than having to answer these questions and then revert back to the law and try and understand what it is you do not have in place, the Guard has this excellent algorithm that as you're answering no to a question, it's going to be automatically updating itself to expose the gap that you just answered no to, okay? So the Guard is going to be identifying those gaps for you. Now, as you can imagine, the government doesn't want you to just identify what you're missing and leave it alone, right? They want you to put plans into place as to how you're going to fix that issue you just found. Okay. Once again, the guard's algorithm will kick in, and as a gap appears, the guard will automatically pair it with its own remediation plan, specifically in writing, as to how we are going to fill that gap. Okay. Now, folks, an overwhelming majority of these remediation plans are going to stem from what is considered the soft side of compliance, really mainly being more administrative stuff, a lot of documentation. And this predominantly deals with what would be your policies, your procedures, and your training. Okay. Now, policies and procedures, they cannot just be bought off of a shelf as a template and then thrown into a drawer, right? Those are very ineffective policies for Carroll County. And more importantly, that will not help you pass an audit, okay? Now, what we're going to be doing here is we're going to be providing you folks with every single policy and procedure that you're going to need to be fully HIPAA compliant, okay? That's all going to be fully loaded into the platform for you. Those policies will be then put into your namesake and then made to fit the uniqueness of Carroll County through the remediation plans that we find, okay? From there, those policies are then are going to be used to train the people that matter most, and that'll be your staff, okay? So at this point, each of the staff members will have their own login to the guard. They'll jump into the guard will let them know, hey, you got Hipaa 101 training due, or you have cybersecurity training due, and they'll conduct that training. And by the way, our training is super simplified as well, in the form of about 7 total trainings spread out throughout the entire year. Each training is about 10 minutes, okay? So they'll jump into the guard, watch a 10-minute video, and then from there, what the guard will ask them if they legally attest to receiving and understanding that training. Each of the employees will click yes. That'll be time-stamped and dated, and then fully loaded into the guard for you folks to be able to pull reports from, okay? So this is very, very important to have this sort of reporting in place, because the amount of times, folks, that we have seen organizations be audited because there's a disgruntled employee who willingly sends wrongful information somewhere, and that turns into an audit. We've seen that hundreds of times. So the real important piece here is to protect the integrity of the organization. In the event that you folks do have, because I'm sure you have, a great deal of staff, in the event that, let's say, you do have a disgruntled member who sends, PHI against the will of the law, that turns into an audit. We're able to prove that, hey, John Smith on April 4th at 2:42 p.m. conducted his Hipaa 101 training and knowingly broke a policy he attested to. Okay, so what that does is that takes the audit away from the organization as a whole, and that is now an individualist situation, right? So that protects you folks against any mishaps or anything like that was broken against the will of your policies. All right. Moving forward is the exterior vendors that you folks work with. Whether you work with, let's say, a medical billing company or an outside, phone service or IT company, these are all what will be considered your guys' business associates, okay? Now, by law, each of these business associates require a business associate agreement signed. Really straightforward at face value, what a BAA is a legal document saying, I am fully HIPAA compliant, you, the vendor, are fully HIPAA compliant. In the event that anything happens between each other or an incident happens on either one of our ends, we're not liable for each other, okay? Now, you have to be very careful when signing these agreements, because if you're signing this agreement and you are in fact not HIPAA compliant and an incident is to occur, if the government comes looking around on that and they find you signed a BAA without being compliant, they consider that, they will consider that essentially you ignoring the law, okay? Now, with that being said, of course, coming through this process, you folks will be fully HIPAA compliant. Every single business associate agreement that you folks are going to need to send out to any vendor, any other outside agency that you work with, that'll all be fully loaded into the guard for you, okay? All of those business associate agreements are there as templates, and you're able to send them out straight through the guard, okay? What your coach will be doing here with you is identifying with you the vendors that you're using or the outside agencies you're working with who may need a business associate agreement or may need a confidentiality agreement, which of course that confidentiality agreement will also be in the Guard for you. You'll be building out these very simple vendor profiles in the Guard, okay, to understand which vendor received a business associate agreement, which one signed one, was it uploaded to the Guard, when does it need to be reviewed or renewed? The Guard tracks it all from there, okay? And then folks, the very final piece to this wheel is incident management, okay? The government requires you have a space within your four walls where you document and track any incidents that occur, okay? So in the Guard, what you'll find is a full incident manager, okay? A laptop gets lost, a malware attack occurs, the wrong email gets sent out, okay? The government wants to know that as soon as you're aware of it, that you have a space where you can document this stuff, okay? So very simple. In the Guard, you'll jump in, put in some very basic information, you know, the subject of the incident, and you'll submit it, okay? Now, when an incident is submitted into the Guard, it does not notify us, and it most certainly does not notify the government, okay? We are not the Hipaa police. We are here to help you, okay? In addition to this rule, the government also requires that each of your employees have a space where they can submit an incident anonymously without fear of repercussion, okay, as per the breach notification rule. So each of your employees or each of the staff members here will also have a space in the organization where they can submit an incident, whether, let's say, John Smith accidentally sent out a wrong email or somebody else lost a laptop. They're able to jump into the Guard, and whether they want to put their name or not, that's their choice legally. And then, of course, anybody who is considered an administrator of the Guard, anybody who wants to receive these sort of updates, will get pinged that an incident has been submitted, okay? And we tell everybody the same exact thing. First thing you want to do is open up the incident. And the second thing you want to do is begin that investigation process by simply picking up the phone and contacting your compliance coach so they can tell you exactly what needs to come next, okay? Of course, like we said before, if this does get submitted into an audit, we jump in for you folks and we take care of that documentation. All right, folks. So really, with just a couple minutes to spare here, what we've covered is a full and effective HIPAA compliance program without a single piece missing. All right. And once you folks come through our process, you will be fully HIPAA compliant. All right. And so that is what we do.
Hey, Lance, I appreciate your time today.
Sure.
Lance, I have a question for you.
Yep.
You alluded to that you would meet with all outside vendors that you deal with or review their policies, make sure that there's compliance. And how about our own internal handbook? Do you review that to make sure that we are not violating anything, asking the wrong question, or also?
No, that's a great question. So just to answer the first part, what we'll do with the outside vendors to ensure that they are secure enough to work with is what we're going to do is we're going to send them out what is considered a technical due diligence. Okay, by law, every entity has to do this with their vendors actually. So what we're going to do is we're going to send them out a 72-point yes or no type questionnaire. The vendor will answer that questionnaire. It'll be uploaded back into the Guard. We will review the questionnaire and let you folks know if they are or are not secure enough to work with, okay? Now, if they are not secure enough to work with, we are nobody to tell you guys what to do. We, of course, will highly recommend you don't work with them. But what we do have here is a very vast, what we call our HIPAA Alliance marketplace, full of many, many vendors across many different types of verticals who we know are fully HIPAA compliant because they've gone through our process, and we are very happy to recommend them to you. So we do that very, very often. Which is no problem. Now, as far as your policies or your manuals go as it sits, we are not a legal team, so unfortunately, we won't be reviewing your current policies. But what we will be, providing you, like I said, is every single policy and procedure you need to be HIPAA compliant, right? So what you're able to do is take those policies we provide you, download them, and add them to your manual. And simply what that's going to do is make them effective for HIPAA, right? great question though, folks. Anybody else?
I think that's everyone, Lance, at this point.
The other question just was asked, pricing.
Yep, sure. So the way that pricing is structured here is really just meant to mirror the law, okay? Just like everything else that we do here, the way that HIPAA law regulates is it regulates per physical location. So with that being said, the last time Dalton and I spoke, and correct me if I'm wrong, you folks are 4 brick and mortar locations, is that correct?
The ambulance. Across from the prison building. Good.
Was that 4 or I apologize?
They're saying 6.
It's 6, I believe, Lance.
Okay, gotcha. No worries. All right. So the way that our pricing is, sorry?
Go ahead.
Yep. So the way that our pricing is structured, the way the model is set up, is that it's done on an annual subscription. Okay. So the reason for that, of course, like we said, is because HIPAA is an ongoing law, right? So every year, what we'll do is we'll readdress these regulations with you in order to keep you compliant year after year, right? Now, there are, every single time we sign a contract with a client, it is only a year contract at a time. You're not committing 5 or 6 years to us or anything of that nature. For whatever reason, at the end of your first year, if you feel comfortable taking this on yourself or you want to move away from this service, all of the documentation that we've collected over the year is yours to keep, okay? We never hold that hostage. All of that is yours to take with you. Now, there are no startup costs to anything that we do, and there are no additional costs or fees to anything that we do. So like we said, you can call us 100 times a day for general HIPAA questions. We can defend you in an audit, provide verification that you're compliant. None of this will ever cost you another nickel more, so use this as much as you need to. Now, what you folks are going to be looking at on an annual subscription would be $8,275 for the entire year, and that'll be all in for everything that you folks will need for HIPAA, and also rolled into that service will also be everything that you folks need for OSHA compliance as well.
So if we go to a year 2 with you, is recertification cheaper than the following year?
Yep, great question. So the pricing remains the same year after year. The only reason being is because our jobs don't actually get any easier year 2. It only gets easier for you year 2 because a brunt of the work has already been provided for you. We still maintain and provide you with all the things that we need to do to keep you guys fully compliant with the training, updating your policies, addressing any business associate agreements we need to do, providing you the security risk assessment, right? We still have pretty much all the same level of work to do. It just gets a little bit easier for you folks year 2. So the pricing does remain the same.
Everything everybody has?
Does anybody else have any questions?
I just want to show you this other option at this time.
Thanks for your presentation, Lance. Very clear.
Absolutely. My pleasure.
Yeah, thank you.
Lance, I'll be reaching out to you to talk to you about today, okay?
Sure, sounds good. You guys have a great rest of your day and enjoy the week. We'll speak soon.
Sure.
Okay. Okay, has anybody got anything else on that, or should we keep moving on? Let's think about this for a little bit, and we'll Dalton, if you could give us, if he's got a PowerPoint of that, if you want to send that to us, that'd be fine. Okay. All right.
I'll send you the stuff from another guy we had a couple weeks ago too. I want to compare apples, so.
All right.
Thank you.
Thank you. Okay, next we'll go to manure management annual update. We have Hillside, section 30 of Arcadia Township. They changed crop rotation for optimum yields. And Twin Rivers Pork, section 22 of Arcadia Township is a 4-year original plan update. Okay, next committee reports. Who wants to start?
I guess I can go ahead and start.
Hold on one second. We missed an agenda item number 4.
Set the public hearing.
Yeah, we did. Thank you. I did. Kind of jumped around her. Sorry about that. Okay, Courtney, when do you want to set the public hearing?
I'd like to set it for March 15th at
March 15th at 10 o'clock.
9:30.
Okay. Is there a motion to that effect?
A motion to set the public hearing for March 15th at 9:30.
I'll second.
Okay, it's been moved and second. Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Aye. Okay. Now we got it all covered. Committee reports.
Okay, I was about ready to start. Last week, I had Region 5 Hazmat meeting. You had the election of officers. Scott Jacobs was reelected as chair. I was reelected as vice chair. And this year we added a treasurer to the mix for an executive board. And this person is Nikki Conrad from Webster County. And the reason for this was simply a lot of it was for convenience, actually, so that if Scott or I can't make it to sign checks, then she could do that for us. So we have to go through that process of getting her signature, but that should not be a problem. The other business that was handled was the contract with the city of Fort Dodge and the discrepancies over the workman's comp situation. There's several options that we're going to try to go through, and it came down to that Scott and I will probably be going up to Fort Dodge to visit with the city council up there and the city manager to come to a resolution on how we're going to go forward with the contract. We don't know how that's going to end up, but I guess the best thing to do is just basically to talk about it. That was pretty much it for that meeting. That evening, we had had a short meeting with EMA, 911 EMA service meeting, and it was basically the public hearing for the budget. There were no issues with that. The budgets were then approved for EMA and 911. There was a lot of done as far as public health last week on vaccinations and availability seems to be a real issue yet going forward. It seems like actually the two pharmacies at this point in time are getting as much as what public health is getting. And So I don't think there's a real good balance there, but it really doesn't make any difference as long as we can get as many vaccinations to Carroll County as possible. That's the best thing. So this week I've got, I did have a conference board meeting today, but it looks like that's been canceled. So with that, I have nothing else. Any comments or any questions?
Okay, I'll go next then. Last Tuesday, I had a policy council meeting for Head Start. We went through the finances there. Things are looking good. The center-based budget is actually behind, and that's due to getting things set up and construction on that projects. We did have an update on those center-based, early Head Start center-based. The one in Carroll is in operation. They had I think 17 kids in there right now. The one in Perry, they were doing their walkthrough on Wednesday. They're sure there's going to be some other things that they need to do yet, so it might be possibly close to a month yet before they actually get operational, but they are in the process of trying to get people hired and are having an issue with that also. So both those facilities will be up here shortly. They talked about self-assessment. That is beginning where that process beginning. They'll send those out to the parents to do that. They did report on an IM alert, and that is in regard to next year on Head Start to COVID, that they're going to get an increase of 1.22 funding. Went through the program goals and where they're at on that, and they're doing very well on that. The other thing we did is we approved the policy 223 for mental health and wellness procedure. Basically, it's strictly a wellness procedure more than anything. There's a coordinator monitoring monitors each child, and this policy talks about how that process is done and how it's completed. And that was basically it. We've got the kids in there on Head Start. We're at 193. Again, that's been cut down due to the COVID, which the state or the feds have approved that we cut it back so we can kind of social distance. Then on Wednesday, I sat on an ISAC webinar with Snyder, and the title of that webinar is Utilizing Your Online Courthouse Effectively, and it was basically with the beacon process. Then on Thursday, New Opportunities had their board meeting. There again, we approved the financials. We talked about everything I talked about on Head Start, so I'm not going to go through that again. We did, when we went through our financials, we did also make a budget amendment. We've had some increases in funding due to COVID, whether it's been emergency care funding or different other places that we've gotten some funding from, some up through Rolling Hills. And so we did increase that about, there was 75,000 one item and 129,000 another one and 72,000 another one. So we did make a budget amendments on those amounts. We did approve the 2020 Community Service Block Grant year-end report, and that was basically that. On Friday, I had the Yes Center board meeting up at Cherokee. Our biggest discussion was the basically cars. We have been buying quite a few cars. We've had, particularly with the storms, we lost two of them here lately. One was a deer running aside, another one that they got lost in a storm that had a situation. And it always happens when they're far out. So, and these are cars that all have a lot of miles on. So we did replace with two cars there. We did purchase another one that day that they had spotted. We did get one from Lyon County, if I remember right. It was a car to use for transport, so that only didn't have that many miles on board that. We did approve a banking resolution That's again authorizing different people to sign different forms in the banks for loans and also the checking. We did approve that. We voted on our insurance premium. We did approve that. We also had a closed session with in regard to our unions on what we're going to do there. And I think basically one of the things that we're looking at also is some of the extra COVID money they got up there. There's put a different locking system in some of the rooms so the clients can't get into, and it has to be key fob or some other way. They were averaging 12 to 13 kids for the month. Yesterday, on Thursday, they had 10, and then on Friday, they were down to 3. So it's been jumping around all over up there. Then on Friday, also was up at Carroll along with Stephanie. We met with different city officials through the county and with Brian Best and Craig Williams, and kind of went over some legislative stuff. I thought it was probably a good session. It was an hour that we went through different bills and talked about different things there. And I thought it went very well. This week I have a CADC on Tuesday at noon, and then Saturday I think there's another legislative forum. And also this week I will be doing the paper and the radio. That's my week. Any questions?
Are you sure I don't have to write paper and radio this week?
No, I think I do. Scott did it last week, right? Yeah, I do it this week, and then you do it next week. You got a blessing. You get reprieve 1 week.
All right, I can go next. Ironically, I'm gone next week, so that works out. No, last week I didn't have any official meetings. I did go with Jean. We did have that little round table. I think it went really well. A lot of the legislation that was brought up of concern. It seemed like there were legs standing behind us, so it didn't stand Brian Best of our concerns we're going to go through. This week, Iowa in the Quad Cities. Wednesday, Thursday, Friday.
I can go next. Last Thursday, I met with Daryl Baker for a couple hours because I'm on the ambulance board now, and it's basically inactive, but he just wanted to bring me up to date on where they are with ambulances and staff, and it seems like everything's functioning well. This week, Wednesday, I'm meeting with Mary Whittree at the landfill, and Thursday, I'm meeting with Jason Creek.
All right, I'll go next. Last Wednesday, is in Holstein for Logan Hills. Items of interest there, the iStart program that is covered by 2 core services also, but the iStart is a non-core. With children's mental health coming, and we only have 4 core services. Right now, we're looking for funding. And so this iStart is getting a long review, and it's kind of covered by 2 core pieces already, so it's a little bit redundant. So I have a feeling that may be on the block for us to move away from that and then to try to pick up a children's mental health. I don't know which one that will be, but we're still in review on that. As I told you before, the Access Center in Sioux City, Rolling Hills, and Northwest. I can't think of their mental health group up there. It's the old Sioux Rivers building. County owns, or Sioux Rivers Mental Health owns that building, but it's not in their area. So they're wanting to, they had hinted around about selling it. We made them an offer. Not respond to the offer, other than they were going to get an appraiser and put it up for sale. So I assume that they didn't like our offer, but we didn't hear that directly. So we'll continue to work on that portion of it. That, I don't think that's a done deal either way at this moment. The next thing I had was on Friday, I had a special session for Region 12. With a rural loan fund. We were trying to federalize 2 different funds. One of them, we were under the impression that we could federalize both to give us more leeway to move it around for different programs. One we can, one not until the July 1st. So we had to we did a resolution to separate those 2 so we could get part of it in play right away, and the other part we'll look at after July 1st. Other than that, this week, I have a WOI on Friday, which is board for Iowa Workforce. That's a statewide, that's a Zoom meeting on Friday. And then I see the conference board's been canceled for today. So, and after Gene said that I may have a CADC meeting on Tuesday then.
Yeah, I'm gonna bring the rest of the board up to the fact that Courtney decided to get off the CADC board. Carroll County has always been being, we're the contributor we are, and so the city also. We've always been entitled to 2 seats. So Rich is going to take that seat for the county so that we have 2 on that board. One other thing I forgot to mention, I think this week also is kind of the start of the ISAC Spring School. So there'll be some of that stuff that we might be attending too, I hope. So anything, Courtney, else you have? Or Dean, you got a question?
Yeah, I got a question for Rich. Rich, do we ever get any reports? Have you ever seen any reports coming from Rolling Hills about county-specific statistics?
No, I haven't been. I mean, about particular programs and participation and that kind of thing. Is that what you, the only thing I've seen?
Yeah. Well,
is
yeah, you know, I mean, we're sticking $750,000 in this thing, and I guess I'm just wondering, what is the county? What are our residents getting back out of this? And I get, you know, when Gene can kind of reflect on this, and Courtney as well, but when Justin Schieffer was our mental health manager, he was here probably 3-4 times a year, you know, giving us updates. And he never gave us specific details of individuals, of course, but he had 3 to 5 case managers, case workers at different times. And they would have, you know, between 27 and 32 different individuals, patients, clients that they were working with. And so you could kind of figure out the numbers of how many people that we were actually serving through those statistics. And I guess I'm just kind of, I haven't really thought about it much until now, but nobody's ever mentioned anything about, I mean, when the family crisis center comes and wants a contribution to them, they always have statistics on how many people they're actually serving in Carroll County. The same way with like Elderbridge and that type of thing, where we know how many people, and I guess I'm just kind of curious. I mean, because of HIPAA rules, you can't say some things, but I think we should be able to know how many people, how many residents of Carroll County are being served by Rolling Hills.
Right.
Is that a fair question?
Yep, that's a fair question, Dean, and that's something I've been giving a lot of thought to. I've not seen those numbers. I did see that we're getting some participation in over at Vale, the housing. There's a newer piece there, and we've had some number of people who have used that service, but I can't tell you how many. I just know that there has been some. That's the questions I'll start asking Dawn now that I'm kind of getting my feet wet a little bit better here, to trying to dig into that and find out. We spent $768,000. We need to find out what we're spending that on.
Well, it would be nice to get some results, of what those dollars are paying for, and the other thing is, I think there are and I would actually, if you can get it going back to when we actually first were formed, that would be nice, because then we can see a trend line of how things are going, whether they're going up or down or what. And I know that there's one other county official from another county has expressed concerns over everything going to Woodbury County and having access to mental health if you're in this end of the region. So I think there are some questions going to be coming up, I think, Rich, on your end, as far as how we're going to be able to best serve the residents of Carroll County and the counties on this end of the region. So.
Exactly, and I think I know that person. I had that conversation Wednesday after the meeting. We had that conversation just briefly. We're watching something that's going to happen in Webster County to see if it benefits us, or see if it's something we just maybe can lease into, or just pay so much and belong to and not own anything. Those are very good questions, and I've been thinking about that on my trips back and forth. Is 168,000. What are we really getting out of it?
Good. Thank you.
Valid questions, Dean. Very valid.
Okay, any other questions? Courtney, do you have anything?
I don't.
Any comments from those in attendance or on live?
They don't work.
Okay. All right. Do we have a lot lined up for next week, Courtney?
Just building.
Bill Day? Okay. All right. If there is nothing else, we are in order for a motion to adjourn.
So moved.
Okay, it's been moved and second. I guess Rich seconded. All those in favor signify by saying aye.
Right.
Aye.
Contrary